East Coast Breakfast.
Sawubona, Dr. Taylor Sandile Shabalala, head of KwaZulu-Natal Department of Health. Good morning.
Good morning, family. Good morning to the East Coast listeners.
Slightly concerned about the cases, the numbers of cases of Mpox nationally, but also in KZN. I think we're up to 13 now.
Yeah, we are at 13 now as a country. We had 7 as a province. There is one that is being tested, whether he is positive. I think what should worry us even more is seemingly what we regard as a democratic history, demographic history, where we're saying these are male, most of whom have a little bit of reduced immune system, and therefore we want to say to all people that are having chronic illnesses, whatever the chronic illness is, particularly HIV, particularly diabetes, they must please take their treatment so that they are well controlled. Other than that, we are still testing the issue of what is happening. There are 2 deaths that we've had now as a province. We are worried because the deaths are increasing. However, those that were infected previously and were not very bad have become much better. But they have gone back to their medication.
So, Togotale, you mentioned there that obviously people who have chronic illnesses, just to make sure that they keep safe and stuff. But in terms of maybe trying to slow down the infections for the other people out there,
yes.
What must just some tips, please?
What is important is that when you've got this rash, these blisters, first isolate yourself, and 2, go and check in the nearest health facility what is this rash about, so that you don't assume that you've got ordinary rash and only to find that you've got Mpox. Secondly, ensure that the people that are around you do not touch you, but also the people around you should support you, and they should make sure that they do not touch you, neither do they touch fluids that come from your body. Now, that is the prevention, but the general prevention now to the community is that of washing hands, that of making sure that you don't touch fluids of a person that is having this rash and these blisters, but also the sharing of clothes, including blankets, because the blisters may be there, and some of the fluids may be left on the blankets, and then you get it from there. You would be thinking, I didn't touch the person, but in essence, you've touched them through the blanket. So these are the issues that we're asking people to really take care of and be assisting the government with.
Weekdays from 6 a.m. on East Coast Radio.